John Mondelli, and welcome to Pet Talk with Dr. Lee. Dr. Lee is the, I guess, co-owner of
Gray Fox Animal Hospital. I own it with my wife.
Dr. Lee Spector, welcome to the show. We're going to be working a lot together in the next few months, and heck, hopefully if this turns out to be a success for years to come.
Good.
What you're going to do is talk about what pet owners can look for at home with their pets, and things that I'm actually going to have pet owners bring their pets in, or maybe some days while the animal shelter bring in some pets and show some pets are out there that are ready for adoption. So a lot to cover, but let's talk about the main reason we got together, and that's Dancing with Gloucester County Stars. I am lucky enough to have you dance for our charity, which is the Gloucester County Educational Network, and for our channel to survive, we actually need people to help out, corporations, and money to come in so we can continue to bring local programs, whether it be high school sports, elections, Woodbury Fall Parade, the Memorial Day service that the county has, and programs like this to educate people about pets. We do law programs. We do a lot, but it's hopefully you get the word out and I get the word out what we're all about. And what impresses you most about what we do? Because you had a chance several months ago to come visit the campus here at Gloucester County Institute of Technology.
I initially was impressed when I saw my wife was competing in Dancing with the Gloucester County Stars last year. And at that time, we saw how important it was for the local television station to be able to project this throughout the community. There's really no other venue for doing this sort of local programming. And it was an incredible thing for the charities and for the community. All because of this one television station. So when I heard that you could use somebody dancing for you to raise some funds for these really important programs that you have, I thought, wow, what an opportunity. Then I got to visit Gloucester County Institute of Technology, where you are based. And I became truly impressed with this school, which has got to be the famed school of Gloucester County.
Absolutely.
You've got so much going here with the students. You've got the culinary school for student chefs. You've got this program for media presentation.
Rich, right now we have 2 students, and it's after school, so the students get paid, but we want to continue to pay them. So that's where we're looking for some community support to help us out, and hopefully we can raise a lot of money come the middle of September when the check announcement comes and we get some nice money coming in. And for those of you who want to donate for Dr. Spector and Dancing with Gloucester County Stars, which, by the way, I've been a member of the committee since day one. I think I was the 3rd one in. This year we will go over $1 million raised for local charities. We will definitely do it. I have faith. But if you want to help contribute, you send a check to the Greater Woodbury Chamber of Commerce, and what we'll do is we'll put that address up on the screen, but I'll say it anyway. P.O. Box 363, Woodbury, New Jersey, 08096. That's the Greater Woodbury Chamber of Commerce, P.O. Box 363, Woodbury, New Jersey, 08096. And your check would be made out to Gloucester County Educational Network, sort of like Channel 12. But we've been bringing local programs local programming to people, this channel, since 1979. But back then it was ran by the cable companies, and over the last couple of years we took the channel over. And we like to see it continue to grow. I mean, I know a lot of times, and I guess I'm kind of dating myself, but we would go out to events, or I'd go to a high school sporting event, for example, and they'll say, well, how come Channel 5's not covering it? And it's like, you've always covered this tournament or that, and it's not as easy anymore. Money's tight, so if we can get, every dollar counts. But if there's a corporation, a bank, a hospital, anybody like that out there really wants to help, and we can offset the cost, your cost, maybe give you some advertising to go along with what you're getting for your dollar. So think about that, and if you have any questions, you can also call me. I'm the operations manager at the channel, and my number, and I'll put it up on the screen, is 468-1445, extension 2115. Enough now of that. Let's get into the pet talk. That's the real reason we're here. And let's get into some of the big problems, things that you hear, and questions that people have. And I actually went around to some people and had them, give me some questions. Good. And you brought some in that you hear. And let's talk about heartworms in New Jersey. How much of a problem is that?
It's a giant problem right now. Heartworms have always been a problem anywhere where there are mosquitoes. And as we all know, the mosquito is our national bird here in New Jersey. The problem's gotten worse, and there are several reasons. One is apparently there's global warming, which makes mosquitoes happy. The second problem is that a lot of the efforts to control mosquitoes, a lot of the insecticides, have been downgraded because some of them are fairly toxic, so mosquitoes rebound from that. The third problem is that along with the mosquitoes increasing in number, we also have an increase of input of dogs with heartworms. When Hurricane Katrina hit, we had a major problem with dogs getting loose and nobody able to take care of them. So these poor dogs were brought up north and rescued up here. Problem was that most of these dogs down in Louisiana had heartworms, and they brought it up. Ever since Hurricane Katrina, they found that they could find homes for dogs, stray dogs, in the south up north. Mm-hmm. So they've been bringing dogs from the south up north. There's a regular train of them coming up, which is a good thing for the dogs, a good thing for everybody, but not such a good thing in terms of heartworms. So they're bringing heartworms up. We've got mosquitoes that are ready to get it, and now we have one more factor that's added on, and that's a strange thing called white nose disease. It's a disease of bats. Oh. The bats in this area are dying off at an alarming rate, about 95% mortality with it, which means 1 in 20 bats still live. Bats are probably the primary predator of mosquitoes.
So without the bats,
mosquitoes are rebounding.
Right. Let's talk about what kind of dogs can be affected. How about the heavy fur dogs, if you have a lot of fur on a dog?
Yes, we've had clients come in thinking that their dogs did not need any prevention for heartworms if they had heavy fur, say a husky. And we can tell you for a fact it's not true. The mosquitoes have had millions of years to figure out how to get through that fur. They can bite them on the nose. I myself adopted a Malamute, which is a heavily furred husky-type dog that had heartworms and had to be treated. So it does definitely happen, and they need to have heartworm prevention. And that's the good news, which is that heartworm prevention is incredibly effective. Usually what's done when the dog starts out, you either start them as a puppy, or you take a heartworm test, a blood test, to find out if they already have these worms that live in the heart. If they don't, you can put them on a pill once a month that will prevent it. And it's important, because if they do get heartworms, these are worms about this long. They're about 6 inches, 8 inches long. They live in the heart, they mate in the heart, and they produce little babies that circulate through the bloodstream. The heartworms in the heart cause heart failure and lung disease. They can only be treated with arsenic injections, which aren't particularly safe, and at this time, they're also not so available. Right. So we really want to try to prevent the disease. That's the key to heartworms.
Okay, let's get on to another topic. How can you tell if your dog or cat has a fever? Can you do it by touching their nose?
Not really.
Old wives' tale?
Old wives' tale,
Old
sorry.
Wives' tale. Okay.
The best way, if you just want to feel them, if you don't have a thermometer to use, would probably be to feel them right about the ears here. Maybe feel them in the groin. Those two areas tend to get real hot if they have a fever, like feeling an armpit. Right. The most accurate way to do it would be to devote a thermometer to it, obviously not one you're going to use orally afterwards. Right. Lubricate it and gently put it in the anus. You get a temperature. The normal temperature of a dog or cat is 101.5. That's a lot warmer than our temperature. And a lot of people say, well, why is that? Is it because they're smaller than us? Right. And the answer is no. Horses have a higher temperature, and so do cattle. In fact, everybody pretty much has a temperature of 101.5, all the mammals, pretty much, except for people. Okay.
Another one. Do dogs and cats have color vision? Can they, or do they just see black and white? Will they know you're wearing a blue shirt?
They would know I'm wearing a blue shirt. They'd see the yellow. Then they'd see all of the other colors as some combination of blue or yellow. They see blue and yellow.
How do we know that? Did they tell you? Dr. Doolittle?
No, you know, yeah. It's usually done with, you find this sort of thing out by doing experiments. You put out little discs of blue, little discs of yellow, you put food on one, you teach them to expect a treat on one or the other color, and you see what colors they can respond to. I think now they can also actually look at the cones in the retina and determine from that what sort of color vision they have.
And one other question that we want to touch on in this segment is a dog's breath. How do you know, if a dog's breath smells, is there something he can do, or why does that happen? Is it the diet? What is that all about?
Dog's breath, it could be diet if you fed them heavy garlic food, But usually if a dog or cat's breath is bad, it's because the teeth are bad. And it usually means that they have periodontal disease, much as we do. They're not brushing their teeth. It's up to us to do that. So one of the things that we like to tell people to do pretty early on, once they have their adult dentition, once they're over 6 months old, is to take a gauze pad and just wipe the outer surface, primarily of the upper teeth, every day if you can. You should spend maybe 3 or 5 seconds doing this. If you spend a minute, the dog's going to hate it. You're going to give up. You're best off doing a very quick, sloppy job frequently than doing a really complete job once in a while.
Right.
You don't need toothpaste. You just need gauze. And I would suggest afterwards you give them a little Cheerio as a treat, just to make sure that they don't mind you doing it.
Okay. Once again, I'd like to remind everybody, Dr. Spector, Dancing with the Gloucester County Stars, the events in August and in September, and he's dancing for the Gloucester County Educational Network. And as I said, programs like this we can bring to you as long as we have money. So we're actually, I guess, begging, but anyway. Send your checks to the Greater Woodbury Chamber of Commerce, P.O. Box 363, Woodbury, New Jersey, 08096. We're going to take a break. When we come back, we're going to have a pet owner who just happens to be my boss come in with her pet, and we'll talk about some signs that pet owners can see and do themselves before bringing their pet to a vet. Take care. We'll be right back. And welcome back to Pet Talk with Dr. Lee. And joining us now, by the way, the greatest boss you could ever have, Lee, is Eileen Shute, who happens to be my boss. And Eileen brought her dog in. Eileen, tell us what kind of dog and the dog's name.
Daisy is a Border Terrier, and she will be 3 at the end of August.
And what Doc wants to do, Doc, in these segments, is you're going to tell people what they can do at home to check their pets for certain things. So why don't you grab Daisy or lean over and tell people what it's, yeah, absolutely. Move the table. And just so what somebody, a pet owner could do at home.
What you could do, if you could put her on the table, please.
Okay. Here, Daisy.
Here we go, Daisy.
Girl.
Here, we're going to have her looking at you. Daisy's your dog, and I want to make sure that she knows you're here and you're taking care of her. And everything I do is with your permission.
Absolutely.
As long as she knows that.
Yeah.
She's a good dog.
She is a good girl.
What you can do, things that people should do for their own dogs. One thing you want to do, this is a 3-year-old dog, so we know she's probably quite healthy. But just the same, you want to be able to look at her head, hold it up. You want to be able to look in her eyes, like this, like that. And what you're doing there is you're looking to make sure that they're glistening like they should. You see that she can, the pupils are nice and black, which means that she doesn't have cataracts. And they're not red or there's not much discharge. If there is a discharge from the eyes, and she doesn't have practically any, partly because she's well taken care of and partly possibly her breed, she doesn't produce that much. But there's certain breeds, I have a poodle, and he tends to produce a lot of discharge from his eyes. And it would get crusty and nasty. He'd end up with an infection here if we didn't do something about it. So what we end up doing is we clean his eyes frequently. We do this pretty much every day. And we just take a look, we take a soft cloth or even a paper towel, you wet it, and you just gently loosen up the discharge and then pat it dry. And that's enough to take care of the eyes of most dogs. If they have more problems than that, they probably should be seen by their veterinarian. Another thing that's a big deal for dogs is to check their ears. They really get a lot of ear problems, and she does not. So we look in the ears, and you look in that ear, and when you do, you might want to sniff it. And if you gag, there's probably something wrong. If there's a discharge in there, if they're real red, this is not. These ears are perfect. If there were that problem, or if the dog acted as if it were painful, then you have a problem. You could clean them out gently, but you probably want to see a veterinarian real soon because you probably are going to need some medication. When dogs have allergies, they typically get problems around their ears and their paws. So you'd be looking at the ears. You can also look at the paws and see if there's nice hair on there, if they're real red, inflamed in between the toes. And you'd also notice probably if the dog's having a problem that the dog would be licking at the paws a lot. Mm-hmm. Does she have any problem like that?
She does not, but the dog we had before her, our dog Charlie, did, and she would lick her leg and her paw till she really had a sore, and we would religiously each year have to go to the vet and have it tended to.
Sure. So paws are important. You also look at the paws, and you want to check to see how the nails are. If they're real long, they need to be clipped. If you know how to do that, by all means do it. If you have trouble doing it, as many people do, you might want to take her to a groomer or to your veterinarian to have that taken care of. She's
Perfect.
really good, this dog.
Perfect. Eileen, I wouldn't expect anything else from you. Okay, well, I'd like to thank Eileen for bringing in her pet.
You're
Dr.
welcome.
Spector, thanks for those tips. And thanks for watching. We'll be looking for you next time with Dr. Lee and Pet Talk.